communicating. How are you using the fact that both of you are doing diagnostics, especially to this subset of physicians who are more receptive to that? They like to see their patients have greater access to diagnostics. How do you use that tool in your communications with physicians when you have this direct communication with them?
In two ways. The way would be, we get 80+% of our patients through direct consumer, direct access. And when we're doing a diagnostic test on them, MSK, EMG, we are given, black and white data showing, that there is an issue of concern that is out of our scope of practice, or we feel that they would much more benefit from having, an orthopedic or a neurosurgeon take a look at their case before we go into, 6 to 8 weeks of therapy, just guessing and thinking, okay, we think we can help you. So by going directly to, we literally will text or call directly that physician and say, hey, we have, in my case, I've got, a 22-year-old hairdresser who came in because her hands are going numb and she's dropping her tools. We did an EMG and it's showing severe axonal loss at her carpal tunnel. We're really scared that this girl is going to lose her ability to be a hairdresser. Can you see her and how quick? And my orthopedic hand surgeon is like, yep, I'll see her tomorrow. You got it. So that has been amazing versus me calling that doctor and saying, hey, I've got a patient who I think has some pretty severe carpal tunnel. Is there any way you can get them into the office? That communication there is huge. And then not to mention that, when we're able to provide those results and give them that data, again, I believe that the credibility of, us in the physical therapy profession is just, highlighted that much more. And we're gaining that trust in our colleagues and the physicians that, in what we're capable of doing and serving their patients.
Yeah, I would totally agree with that. And the other thing I would say is that when we're meeting with some of, getting acquainted, in particular, I'll use the example, the last meeting we had was with this neurosurgeon, just sometimes asking them, one, in their practice, we ask them, do they do EMGs and NCVs? Do they do electrodiagnostic testing? And come to find out that they used to do it, but they stopped doing it. So then we were asking them why, and then we let them know that we actually are Medicare certified to do the testing. And they were like, they just don't know. So now they had another option of where they could send their patients for the testing. And then we got into a big, long discussion about testing, why we do it. So all the things that Angie talked about, when we're having patients come to us off the street, things we find, help we need. And I feel like it just, you can see that full circle of how you start to look and say, well, how can the two of us work together? What's the relationship? And I agree with Angie. It's like having a good enough relationship. Like we had a patient that came in off the street, but they have drop foot, so we do an EMT. We're like, this person needs to see, we need to get them in. They've got a lot more going on than, there's a lot more going on. And so being able to have that good relationship where you can just text or pick up the phone and say, I really need you to see this patient right now. I'm really worried about this patient. So I feel like they appreciate that. And it's so much, I just find that's so much more, it's so much more fun to have that kind of communication with a referral source.